Calhoun.
Ladies and gentlemen of the committee, my name is Dr. Bob Calhoun. I've been a family medicine physician for 10 years. I've worked all over North and Central Louisiana as an emergency room physician, both before, during, and after the COVID pandemic. I serve as a lieutenant colonel in the Arkansas Air National Guard, where I'm the officer in charge of expeditionary function for the 189th Airlift Wing at Little Rock Air Force Base. My private practice, Paraclete Health Solutions, is Northeast Louisiana's first and only direct primary care practice, and I'm only one of a handful of physicians in North Louisiana, who has training in functional medicine. I'd like to open by telling you about an experiment that's reported to have been done by the KGB in Soviet Russia during the 1960s. They apparently learned that if they were to bombard the population with fear messages, dire warnings of an existential crisis, that within a few months, most people came to believe that message was true, and further, that they would reject evidence to the contrary if it was presented to them later. And I'm not going to belabor the point because I know that we've had a lot of people talk about how fear drove public policy. But I would invite you to remember the dark, brooding music when the news stations would shift over to the pandemic report with a chyron across the bottom of the screen tallying death tolls and infection rates reported. And all of the conflicting messages that we were given. 2 weeks to flatten the curve. No, a month. No, 3 months. Save the masks for the healthcare professionals. No, everybody needs a mask. No, everybody needs 2 masks. And on and on. And I'm not going to belabor the point, but I do think that even the most intelligent were not immune to this, because that form of psychological warfare short circuits the part of your brain that's responsible for critical thinking, the prefrontal cortex, and it forces you to use the amygdala, the part of you that thinks emotionally. All it took was one time to get you to be existentially scared for your life, your children's life, your mama's life, your grandma's life. And that's all it took. And after that, you were thinking with your amygdala. So when we were given guidance from the CDC for therapeutic nihilism or ineffective treatment plans like remdesivir and intubation for those in late-stage COVID, the healthcare professionals carrying out this guidance, and they were all acting in what they believed to be the best interests of the patients, I think. They suffered great emotional and psychological harm from watching people die, alone and afraid from a disease that never should have been a threat to anyone and could have been treated with simple and inexpensive drugs, as I have done, and I will demonstrate. Faced with the bleak choices available, I, like many of my colleagues, began researching the various treatment methods available. I saw that therapeutic nihilism was harmful for most patients, and the major health organizations we trusted were either silent or giving bad advice. So I began looking for resources in other locations. In April 2020, I found that treatments like hydroxychloroquine and ivermectin were showing great promise as therapeutic alternatives for COVID-19 at all stages of the disease, and I want to emphasize that, all stages, from prophylaxis to ICU. And people were concerned yesterday about what if we have the next pandemic. There are effective means of prophylaxis for COVID and flu, and I use them all the time for my patients. I put together protocols for my own family, my patient panel, and for the hospitals where I was seeing COVID patients, both in the emergency room and inpatient settings. Immediately, I saw incredible results in all of the patients I treated with these protocols, in that every one of them recovered quickly from their illness without complication, regardless of the phase of disease or what comorbidities they had. During this time, I was the director for the emergency room at Jackson Parish Hospital, where the ER doctor was also responsible for inpatient care. The pharmacist there and I discussed the research available, and I convinced him to stock ivermectin and hydroxychloroquine. Every time I came on shift, which was usually for 48 or 72 hours, I would switch everybody on COVID protocols to the ones that I knew, from the frontline COVID critical care doctors in the American Association of Physicians and Surgeons. And without fail, by the time I was ready to go home, they were being discharged, even if they had been previously slated for transfer to an ICU when I had gotten there. As I continued to research, I saw there was similar success to my own in all locations around the world. I learned that the Indian state of Uttar Pradesh and several countries in Central America had managed to all but eliminate COVID by implementing an aggressive public health campaign using ivermectin, zinc, vitamin D3, and a few other inexpensive supplements, all of which I had been using and still use today. I was encouraged when I continued researching and found that two organizations, as I mentioned before, had findings and recommendations that mirrored my own, so I offered to be listed on the FLCCC website as a physician willing to provide treatment for COVID. Immediately upon being listed, I was inundated with calls from people all over the country who couldn't get treatment for COVID asking me for help. I launched a COVID-19 telemedicine consultation service where I provided treatment recommendations and prescriptions for as many people as I could. For people who could get the medications I prescribed, and that was a challenge, the success rate was 100%. I was encouraged, and I found by the success I had, and I was happy to offer hope to people who were in despair. But it's at this point that I began to find difficulties in providing treatment as a result of the policies enacted by the state of Louisiana and federal health organizations when they publicly denounced the use of ivermectin and hydroxychloroquine, and when the Board of Pharmacy started allowing their pharmacists to refuse to fill my prescriptions. And the problem was that this wasn't a dosage error or a contraindication or a drug interaction or even a moral issue that was causing these pharmacists to refuse. They simply disagreed with my approach because they didn't like the reason I was using it. I initially tried to argue with them. I offered to send them my research. I even threatened to report them to the Board of Medicine for practicing medicine without a license, to no effect. They knew that the Board of Pharmacy would never hold them to account. Eventually, I was able to find small pharmacies in each region of Louisiana that would fill my prescriptions and started using them as my go-to pharmacies for patients in that area, but it was a hard-won and small victory. Complicating the matter further is that while initially Medicaid would cover some of the cost of these medications, shortly after the beginning of this, they implemented a prior authorization requirement for ivermectin and hydroxychloroquine, which was previously not there. The only question on this form was, what disease is being treated? If the answer was COVID, the claim was automatically denied. Because of the grossly inflated cost of ivermectin, available for pennies in other countries, and very inexpensive here in the U.S. until 2020, many patients who would have greatly benefited from early treatment or pre- or post-exposure prophylaxis suffered needless harm. Because of the bureaucratic, logistical, and financial hurdles the government created, many patients weren't able to get the treatments I recommended or other people recommended, and they suffered complications from COVID-19, developing long-haul COVID syndrome. I've had calls from many such patients asking for help, and I've been able to get many of them on the road to recovery by implementing protocols shaped by the frontline COVID critical care doctors. To date, in all settings combined, I've treated thousands of patients and at least 700 in my own private practice where I'm the solo person there. I have no front office, I have no back office, I answer my own phone. I've never lost a patient who was able to follow my recommendations, and I've had 2 people that were on a vent that got off. I'm not certain of the best solution for this problem. I do know that most importantly, there must be a strident and enforceable demand for transparency and accountability from the organizations making public policy decisions. Also, there must be room in the discussion for legitimate dissent without fear or reprisal. We as physicians must be free to make good faith recommendations to our patients based upon our best professional judgment and to inform patients of the reasonable alternatives to the guidelines suggested by the health organizations. This is one of the foundational principles of informed consent, which is the very core of medical ethics. Clearly, there needs to be some way to accommodate a pharmacist's legitimate medical or moral concern, but there needs to be a check against pharmacists exercising their power over simple differences of opinion or personal preferences. If we're going to allow pharmacists to countermand a legitimate medical order from a licensed physician for a medication safer than aspirin and Tylenol, which has been approved for use in humans for over 40 years, for any reason at all, then we're essentially allowing them to engage in the practice of medicine. If we're going to allow medical bodies to censure physicians and suppress their speech for well-reasoned opinions supported by evidence, for treatments which produce excellent clinical outcomes, then there is no longer an art of medicine. We're simply a different form of bureaucratic functionary beholden to whatever pharmaceutical company or political body has the power to compel us to action or to silence. How to resolve these tensions I leave to wiser minds than my own. I am not a politician or a bureaucrat. In fact, I've dedicated my entire practice to avoiding entanglement with such things. What I am is a physician who is tasked by God to provide healing and comfort for the sick and to help people become and remain healthy. I've helped a lot of people, and more each day come to me for the help I provide. It would be a lot easier for me to do my job if it didn't feel as if I had so many powerful people, some of whom could end my career with the stroke of a pen, working against me. Thank you for your time.